Welcome back, my people. We are still discussing about warts, and we were discussing about the treatment modalities available for this kind of a disease. But before we continue, let me continue appreciating you people for the continued support you are showing to me. Continue subscribing, liking and sharing our videos so that we may reach as many people as possible. So let's continue our discussion on the treatment modalities of this kind of a disease or of warts. So we are in our point number 3 about the treatment modalities, and this is what we call electrosurgery or curettage. Electrosurgery or curettage. This simply electrosurgery involves burning the wart or using electrons or simply burning the warts. Good treatment for common warts. This is a good treatment for common warts. That is, burning is a good treatment for common warts. Curettage involves scraping off the wart with a sharp knife or small spoon shaped tool. So in electrosurgery and curettage, electrosurgery simply involves burning the wart, whereas in curettage involves scraping off the wart with a sharp knife or small spoon shaped tool. Number 4, we have what we call excision. Excision simply means removing the whole thing. So doctor may cut out the wart or cut the whole thing out and stitch the area where the wart was. And after this, the patient is given antibiotics and then it heals. So note this, and this is very important. If warts are hard to treat, the doctor or the dermatologist may use one of the following treatments. And this is very important. If warts are hard to treat, the doctor or the dermatologist may use one of the following treatment modalities or treatment methods. We have what most people know as laser treatment. Laser is an option for warts that are hard or warts that have not responded to other therapies. Before laser is done, the doctor may numb the affected area with an anesthetic injection. This is simply to reduce any chances of the patient feeling a lot of pain. Number 2, we have what we call chemical peels. This involves application of peeling medicine at home daily, especially where there are many warts. Chemical peels involves application of peeling medication. This means you apply a medicine topically that will peel off the wart. So chemical peels involves application of peeling medication at home daily, especially where there are many warts. For example, all examples of such chemicals are salicylic acid, tretinoin and glycolic acid. Number 3, we have biomycin. So the warts may be injected with anti-cancer medicine, biomycin. That is another form of treatment, whereby the wart may be injected by anti-cancer medicine, biomycin. The next point, we have what we call immunotherapy. This simply means using the patient's own immune system to fight warts. As we said before, Warts is caused by human papillomavirus, which is a virus. Like in the case of flu is always a virus which your body simply can fight it away without any treatment. So in immunotherapy is whereby you use patient's own immune system to fight the warts. This is used when the warts remain despite other treatments. For example, you apply chemicals or you apply the chemical pills, but the warts recur or doesn't go away. So it's used whereby warts remain despite other treatments. For example, if you apply chemicals like DCP, which is diphenhydramine, and the warts remain. So using patient's own immune system to fight warts, it's used when warts remain despite other treatments. For example, applying chemical like DCP to the warts. A mild allergic reaction occurs. So when you apply the DCP or the diphenhydramine, a mild allergic reaction occurs around the treated wart, and this reaction causes the wart to go away. So when you apply this DCP, a mild allergic reaction occurs around the treated wart, and this reaction causes the wart to go away. Note this, immunotherapy may also involve getting shots or injections, getting shots or injection, for example interferon, to boost body's immune system, and this helps the body to fight human papillomavirus. Note this point, immunotherapy may also involve getting shots or injections of interferon, which boosts body immune system, and this helps the body to fight against human papillomavirus. So how do you diagnose, or how can a doctor diagnose warts? Number one, through physical examination. So if you examine a patient having warts, you will just see them bumpy like freshy growths, which may be sometimes flower-like, especially when they are the genitals. So through this physical examination, the doctor can tell whether it's a wart or not. Number two, the doctor can decide to do what we call a skin biopsy, whereby a part of the skin which is affected by the wart is taken to the lab, and several tests are run to see whether there is this kind of a virus or human papillomavirus. So this can lead to a diagnosis whether somebody is having warts or not. So this marks the end of our discussion, and tomorrow we will be discussing about other conditions which can be misdiagnosed or can be misjudged, or which can be related to warts, for example corns. So we will discuss them in our next video. So guys, thank you for your time, thank you for being with me, thank you for the support you are showing, thank you for the returning subscribers, thank you for the new subscribers. So let's continue sharing, liking, and making our videos reach as many people as possible, and I know they will help your brother, your sister. So for those who had requested this topic and have been pushing me, why have you not discussed about this topic, I know now you have got what you have been looking for. So let it be of important use in your life. So guys, have a nice time.